Let me paint you a picture. A guy in his mid-40s works hard, eats reasonably well, goes to the gym when he can. But for the last 2 years he has been dragging himself through the day. His motivation is gone. His drive is gone. He figures it is stress. He figures it is age. He figures everyone feels this way. So he says nothing to his doctor. He does not even book an appointment. And here is the thing, he might be right that it is age. But there is a real chance something measurable and treatable is quietly running in the background. Testosterone is not just the hormone that makes men want to go to the gym or pick fights. It is a foundational chemical that runs quietly through almost every system in the male body. It helps maintain muscle mass, bone density, red blood cell production, mood regulation, and yes, sex drive. Doctors have known since the early 20th century that men whose testes were damaged by infection, injury, or radiation lost much more than libido. They lost energy, strength, and a certain vitality that was hard to put a name on. That is what testosterone is actually doing under the hood. The medical term for low testosterone is hypogonadism. It sounds complicated, but the definition is actually quite straightforward. The American Urological Association uses a number, 300 nanograms per deciliter of blood. If your total testosterone comes back below that threshold on a proper morning blood test, and you have symptoms that match, that is the clinical definition of low testosterone. 2 conditions have to be met. The number alone is not enough. The symptoms alone are not enough. You need both. That distinction matters more than you might think, and we are going to come back to it. Here is where it starts getting interesting. Testosterone levels do not just vary between men. They vary across a single day within the same man. Levels are highest in the morning, typically between 7 and 10 am, and they drop through the afternoon. That is why the guidelines are specific. You need a morning blood draw. And not just one. You need it confirmed on 2 separate mornings before a diagnosis is made. Most men who get tested once, at the wrong time of day, and the result either falsely reassures them or falsely alarms them. The test itself has to be done right. So how common is this actually? The honest answer is it depends on age, and the numbers climb steeply as men get older. Around 12% of men in their 50s have low testosterone. By their 60s that rises to about 19%. By their 70s it is roughly 20%. And by the time men are in their 80s, nearly half of them are below that clinical threshold. The key word here is age. Testosterone production starts declining after about age 30, dropping roughly 1% per year. That sounds small until you do the math over a decade or two. Now here is something that genuinely surprised researchers when the data started coming in. It is not just that individual men lose testosterone as they age. Average testosterone levels across entire generations appear to be falling. A major study using data from the Massachusetts Male Aging Study compared men of the same age across different decades and found that men tested in the early 2000s had testosterone levels roughly 15 to 20% lower than men of the same age tested in the 1980s. Same age. Lower levels. That means a 40-year-old man today may be starting from a lower baseline than his father did at 40. Why is this happening across generations? Researchers point to several overlapping factors, none of which are dramatic on their own but add up over time. Rising obesity rates are a big one. More sedentary jobs. Chronic sleep deprivation. And something that gets less attention than it deserves, endocrine disrupting chemicals. Things like phthalates and BPA, found in plastics, food packaging, and personal care products, interfere with hormone signaling in the body. None of these are smoking guns on their own. But together, across a lifetime of low-level exposure, the picture starts to make sense. Let us talk about obesity specifically because this is one of the most important and least understood connections. Fat tissue contains an enzyme called aromatase. What aromatase does is convert testosterone into estrogen. So the more body fat a man carries, particularly around the abdomen, the more of his testosterone is being quietly converted into estrogen. This is a direct biological mechanism, not a theory. And here is the part that matters: it is reversible. Studies show that losing 10 to 15% of body weight can meaningfully raise testosterone in men with obesity-related low T, sometimes enough to normalize levels without any medication at all. Type 2 diabetes and low testosterone have a particularly nasty relationship. Men with type 2 diabetes have significantly higher rates of low testosterone, with some studies putting that figure between 25 and 50% depending on how it is measured. But it goes both ways. Low testosterone worsens insulin resistance, which makes blood sugar harder to control, which drives more metabolic dysfunction, which drives testosterone lower. It is a loop. One condition feeds the other. If you have been told you are pre-diabetic or have metabolic syndrome, your testosterone levels are worth knowing about. This is not a separate conversation. Sleep is another factor that most men seriously underestimate. A small but well-designed clinical study found that even 1 week of sleeping just 5 hours a night dropped daytime testosterone levels in healthy young men by 10 to 15%. 1 week. And for men with obstructive sleep apnea, the connection is even stronger. Sleep apnea is independently associated with low testosterone. If you are snoring heavily, waking up unrefreshed, or your partner has noticed you stop breathing at night, that is not just a snoring problem. That is a hormonal problem too, and it is worth investigating. Now let us talk about symptoms, because this is where most men get confused. The symptoms of low testosterone are real, but they are not specific. Fatigue, low mood, reduced concentration, decreased motivation, less interest in sex, more belly fat, less muscle even when you are training. Sound familiar? The problem is that every single one of those symptoms can also come from depression, poor sleep, thyroid problems, anemia, overwork, or just a genuinely hard stretch of life. This is what your body is actually trying to tell you: something is off. But the lab test is the only thing that tells you what. Most people get this completely wrong, so let me fix that. Many men assume that if their testosterone is below 300 they automatically need testosterone replacement therapy. That is not how it works. The guidelines are clear: you need symptoms plus a consistently low reading on 2 separate morning tests. A man who tests at 280 but feels great, has normal energy, healthy libido, and no bone or muscle concerns may not need treatment at all. And on the other side, a man sitting at 320 with significant symptoms and high SHBG, a protein that binds testosterone and makes it unavailable, may actually have less usable testosterone than his number suggests. And here is the million-dollar question: what about testosterone replacement therapy itself? For men who genuinely have low testosterone with matching symptoms, TRT can be genuinely life-changing. Energy improves. Mood improves. Muscle responds better to training. But it is not a simple fix with no strings attached. TRT can suppress sperm production, which matters enormously for any man who still wants to father children. It can worsen sleep apnea. It can raise red blood cell counts to levels that increase clotting risk. Men on TRT need ongoing monitoring of their levels, their blood count, and their PSA. It is a medical treatment, not a wellness supplement. Speaking of supplements, let us be direct about over-the-counter testosterone boosters. The shelves are full of them. The marketing is confident. The evidence is not. Most of these products are mixtures of herbs, vitamins, and minerals that have little to no solid clinical evidence for raising testosterone in men with true hypogonadism. Some contain undeclared hormones. Some interact with medications. Some have been linked to liver toxicity. If you are genuinely concerned about your testosterone, the path forward is a blood test and a conversation with your doctor. Not a supplement that costs $40 and promises to make you feel 25 again. There is one more group worth mentioning: men who have used anabolic steroids, either for bodybuilding or performance. Here is what happens. You flood the body with synthetic testosterone. The brain detects the high levels and shuts down its own signal to the testes, because it thinks production is already handled. When the steroids stop, the testes have been sitting idle. Natural production can take months to recover, and in some cases does not recover fully. Men who have used steroids and then stopped can end up with profoundly low testosterone and measurably smaller testes. It is one of the more underreported causes of low T in men under 40. So what should you actually do with all of this? If you recognize yourself in any of those symptoms, especially if you are over 40, carry extra weight, have been told you have prediabetes or metabolic syndrome, or sleep poorly, it is worth bringing up with your doctor. Ask specifically for a morning testosterone test. Ask for it to be repeated if it comes back low. Ask about your free testosterone and SHBG, not just the total number. You do not need to walk in with a diagnosis. You just need to walk in with a question. That is the whole point of knowing this stuff before something goes wrong. Low testosterone is not a vanity issue. It is not about wanting to look like a magazine cover. It is a genuine health marker tied to bone density, metabolic health, cardiovascular risk, and quality of life. The men who suffer most from it are often the ones who never find out they have it, because the symptoms crept in slowly, because they assumed it was just life, and because nobody ever told them what to look for or what to ask. You now know more than most men walking into a doctor's office. That knowledge is the whole point. Use it. If this video gave you something useful, hit the like button because it genuinely helps other men find this content when they need it. Subscribe to Men's Health Simplified if you want to keep getting information like this in plain language, no jargon, no panic, just the stuff that actually matters. And leave a comment below if there is a men's health topic you want me to break down next. I read every single one. Take care of yourself. And I will see you in the next one.